I'm not the house of cards that falls down easily. Oh, I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristin Sunanta Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years, and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all, we promised we'd be cordial.
Gustavo and Kelly, thank you so much for coming on Mental Health News Radio.
Thank you for having us, Kristin.
Yes, thank you for having us.
Absolutely. I'm so excited about this topic because we talk about so many different aspects of technology and different ways of getting your needs met in terms of mental health. And a lot of people still don't understand what telehealth is. They don't understand how it can be helpful. There's a lot of arguments around it. So I'm really glad that the two of you are going to help us know exactly what the heck it is.
Sure.
Absolutely. So first off, I always want to ask, why do you do what you do? So let's start with you, Gustavo. Why is it that you are in the field that you're in, not just the telehealth part, but, why are you working in this field that, is mental health?
Well, I've been in the field for over 25 years, but as it pertains to telehealth and virtual care, there is a global mental health crisis. Everyone seems to be talking about, mental health struggles. So, in many ways at Teladoc, we wanted to know more, and Teladoc offers a number of platforms that provide easy access, discrete ways for individuals to actually access care that otherwise they wouldn't, due to stigma, time, privacy issues, and so forth.
Yeah, absolutely. Yes, it does help with those things. But for you, and maybe this is an answer, for both of you, Kelly, you too, what is it about that mental health piece? Because it's very different from if you have the flu, or you are doing a blood pressure check, or you are doing a different kind of consultation. Mental health is a whole other realm, especially introducing the telehealth piece. So why, how did your windy road of a career take you to a space where mental health is part of an initiative?
Yeah, no, absolutely. My windy road of a career certainly has taken me around the bend. I started actually my career, believe it or not, in human resources. And so on the other side of the fence, if you will, from where I sit today. And I do what I do largely, I think, for me, it starts with a story back when my mother was quite ill many, many years ago with a disease called trigeminal neuralgia. And it was a very difficult time in our lives as a family unit to support her and helping her navigate both diagnosis and the right treatment plan for her. And it was all consuming. And at the time, there really wasn't a vehicle for us to access and to get the care and to have a single entry point into the healthcare system.
Right.
And so whenever I heard about, virtual care and telemedicine, and certainly have grown to understand its new use cases in 2020, it hit me that this is what everybody needs. Everyone needs a doctor in the family. Everybody needs somebody to help them navigate, whether it is whole healthcare, whether it is a diagnosis like my mother's, who was really struggling to identify what was going on with her care, but also beyond that, in mental health as it applies to those people that aren't getting care and aren't seeking the care that they need, So virtual care can be that front door to the healthcare system. And so I'm pretty
Absolutely.
passionate about that. And so that's why I do what I do, to help our clients navigate those waters.
Yeah, that's so true. Because I always think in this fast-paced, busy world that we have today, even if you have people that work outside the house, they're working outside the house, have kids or don't have kids, you don't have much time to go take care of anything, to even go to the dentist. Or like for me, I'm doing what I do running this network and also doing technology consulting for EHRs and the list goes on and on. For me to have to step outside my house to get a haircut feels like, oh, do I really like have to do that? You know what I mean? So if I can just sit down and, get a counseling appointment, doing it this way, especially a counseling appointment related to my mental health, which already is like, I don't want to deal with my issues in that realm. So I really don't want to have to make an office visit.
Exactly.
I mean, I don't. I'm never more comfortable than a therapist's couch, but I'm just saying.
There's largely no stigma associated with going to the hairdresser, right?
Right.
Maybe a stigma if you don't, but right. I think there is an opportunity here to, certainly we see in mental health, virtual care being a tremendous use case for addressing that stigma.
Absolutely. Absolutely. Yeah. For me, it's a no-brainer, but I have had people say, oh, you miss that experience of when you're in person. And I'm like, nah, the way the technology works today, I don't buy that anymore.
Absolutely. You can have a video visit and have that same experience, if you will, but from the comfort of your own home, living room, workplace, where you want to seek the care.
Yeah, your car. I've had people that they don't want to do this at work. They go and they go sit in their car and they have their appointment. They don't even have to drive anywhere. They just walk out of work and they're doing it. So it opens a lot of possibilities. But I'm really excited about, you have results of a global workplace mental health study from last quarter. So what is that and why, what prompted your interest to conduct this kind of research?
You want to take that?
Sure. Yeah. Well, as in many ways, Teladoc is as the global virtual care leader. Our group ourselves, came to the realization that we needed to understand those mental health struggles in the workplace and how the impact of the stigma surrounding workplace mental health, and the challenges that actually in employers around the globe are facing. According to the World Health Organization, about 25% of individuals, worldwide will be affected by mental health disorder, during their lifetimes. And here in the U.S., the statistics are very close, about 20%. But just going back to the study, I mean, we definitely wanted to have a better understanding about that, and so we conducted the study late last summer, and over 3,800 employees participated from across 4 major international markets, including the U.S., Canada, Australia, and the UK. And it was actually conducted by an independent research firm. The research actually confirmed that while there's a growing prevalence of conversations, and somewhat of celebrity power, behind mental health,
Yep.
stigma is still an issue at the workplace, particularly in the U.S.
Yep.
For sure. I don't know if you, I'm sure, Kristin, you saw Lady Gaga recently spoke quite openly to Oprah about her diagnosis and therapies.
Yep.
And it's a great example of, I think, individuals sort of leveraging what I would say is bold transparency to bring awareness to the crisis and to lessen the stigma. And so I think our research was really, it was born from our own population and our own employee base, seeing the use case for virtual care, and obviously inherently in our offering is behavioral health services through virtual care, and they wanted to really understand, well, what if we know there's barriers? I think all of your listeners probably can appreciate the stigma associated with it and understand and connect with that. But we really wanted to understand, and that's what the findings found. I mean, it really supported that It's the stigma is preventing people from seeking the needed support that they need. And it was eye-opening for us.
Agreed.
Conducting that survey.
Do you feel like, this had to obviously affect, your organization internally as well. So what I see happening with companies is, oh yeah, okay, now we have a mental health initiative. It's popular. It's going to make us look like a better company because we have this initiative. We're jumping on the whole popularity bandwagon here, but then it's still, you're like, okay, well, we don't really mean it.
Well, I think luckily
I figure that's not your problem.
It really is not our problem. I mean, it's core to our mission. We really and truly, we're creating a new kind of healthcare experience with greater outcomes and convenience and value. So unlocking those digital experiences and applying them to mental health is what we're passionate about. And I think what we learned was that net leaders need to lead. And if we are going to be leading in virtual care, specifically around behavioral health, we need to lead and have those conversations internally. We actually just had one last week with our management team, our broad global team. Not only, luckily we were able to invite some industry leading experts to come in and talk to our team about how do you have those conversations in the workplace and how do you approach that in a way that really opens doors and doesn't close them. And so it was a fantastic conversation, but I think, our findings sort of affirmed what we assumed, which was that there is a stigma.
Mm-hmm.
And to your point, how do you navigate to doing something about that stigma in the workplace?
Yep. I'm thinking, oh my gosh, you guys are doing this. That means your own people, your own employees, no matter where they are on the, the hierarchy of the organization, are going and doing this. How amazing to work at an organization where, hey, you just did your mental health checkup. Awesome. Instead of, yeah, I'm going to do that mental health checkup. You know what I mean?
Right.
Kristin, let me just interject here with a few actually numbers to support.
Yeah, please.
How Teladoc takes so seriously, and I can attest to that as we lead the way. Although the key findings from the study underscore that mental health stigma prevents people from seeking support. If the access is there, we have actually seen not only among our employees but our users and members an increase of over 100% utilization of various platforms that we offer.
Awesome.
The numbers really speak for themselves, and in many ways our experience is that mental health care and seeking actually mental health assistance and help has been driving the whole virtual care system. In terms of increased usage, increased utilization, increased people seeking,
and increased comfort level at actually doing it.
Absolutely, seeking, using and benefiting from this wonderful tool, which really we believe is a good roadmap. Is really the way of the future.
Right. Ask you this, I do a lot of first responder work with, first responder mental health and things like that. And I always think, okay, well, when you're in a situation where your workplace is a mental health organization or they're an organization that offers mental health services, and let's say, a firehouse offers mental health services now with counselors that also work for the fire department. Sometimes staff can feel uncomfortable with sharing their mental health issues with someone that they know works for the same organization. Some places there's not an issue.
Right.
At some places there are. So tell me how you guys navigate that at Teladoc.
Well, let me animate that for you. We had a case recently, which is exactly that scenario. We had a 48-year-old female in the Pacific Northwest, and she was the chief of police for a very small town. And she actually had a history of personal trauma and witnessing significant workplace trauma. And she would have these flashbacks. And in a small town, talk about not wanting to walk in to seek mental health care.
Oh, yeah.
In the stigma associated with that. And so she was obviously very uncomfortable seeking care, but recognized that she needed to seek care. And so she was able to leverage virtual care. She was actually seen by a practitioner in another state. And she was able to be seen on the weekends from the comfort of her own home. And then our treating therapist would then work with her local pharmacy and mail in her prescription. So she was able to access care from her home and address her needs without the stigma and without people having, her being concerned that she wasn't.
My department is going to find out about this kind of a thing. Yeah.
Yeah.
What about you guys internally when you guys, you're doing your own mental health initiative where you all internally, are you're doing it as you roll it out to, the public. How about your employees feeling I'm sure it's physicians and counselors that work for Teladoc. How are you guys handling that?
For sure. It's a great question. And it's a barrier to care as a virtual care company, right? We actually have exceptional utilization across all of our services. I think we all, drink the Kool-Aid. We understand the value of virtual care services. But there is that sort of natural tendency, whether that is a mental health service or if it is a diagnosis service.
Right.
So we have to put protocols in place organizationally to ensure the security of that for our own populations. So we limit that access to information internally to create certainly the comfort level that we need, but it's frankly not a barrier here. I think people really do appreciate and the use of the tools that are available to them.
I mean, that's the reason why I say that is not to put you on the spot. It was really to show that that's another place where stigma can live. And you guys are showing that it doesn't even need to live there at all. You can have a safe environment within your own organization doing something like this, and it will make it a better workplace.
For sure. And I think our population, not just the work that we do, I think the demographic of our population, one of the things that was important to our study and the findings that was research about how younger people around the globe are really demonstrating poorer mental health than previous generations. We tend to have a younger population organizationally, and they tend to want to talk about their symptoms, but they, as our results have found in the survey, they aren't. 61% of 18 to 25-year-olds say mental health symptoms have affected their job, and they've been diagnosed, but they have not reported it. And so that was more broad to the survey, less about the population at our organization, but it's concerning because what we're seeing is those younger generations are experiencing more difficulty even accessing the care. And we see virtual care as the key to driving that access and providing additional resources available to them.
Fantastic. I was going to ask you about that because, millennials, which I'm considered a millennial. I'm sorry. I'm not. I don't even know anyway. I'm Gen X, I guess. My son is a millennial, and it's very different, the conversations that he can have about mental health than, my generation. It was like, forget it. We didn't even know what those two words were doing together forever. So I'd love to know, I'm sure you have people that are, all the way up to boomers, all the way down to Gen Zs working for your organization. What are you seeing across different generations in terms of the language that's used around mental health?
Well, I mean, just to complement what Kelly just mentioned, 43% of respondents in our study believe there is a stigma and want remote forms of care. So that's a substantial, mental health is most definitely driving utilization of virtual care in general. We see virtual care having a big impact, and a good example actually is actually another small story, and I'll keep the details, of course, to protect the privacy of this young lady who has been struggling I have many stories like that. They were struggling at work, crying after work every day, didn't have energy, want to be social, have difficulties, telling people because no one expected it, her to feel that way. And an insurer email happened to come the next day at work to introduce behavioral health navigator service. That's one of our platforms. So she reached out and felt there was a kind, caring person on the other end. Carried out a video conference, which made her feel more at ease. She started to feel better, made her feel comfortable. She began to feel like herself again. And in fact, she actually reported that she was quite surprised at how easy it was. Just to circle back to a couple of your questions, and we're talking about different generational differences. One of the interesting things that we found is that we have high utilization in a number of other platforms, which range from text messaging, phone calls, and video calls.
Right.
And that offers a plethora of different options that members or individuals seeking mental health or counseling or visits that include medication management as well, to choose from. And that's actually been great, high utilization in all of them. And we really haven't seen, other than among millennials, as you mentioned, any particular pattern or preference, although offering multiple options has been a great equalizer, if you will. We like to say that virtual care can be the great equalizer, as it provides the access. I like to say sometimes that it offers a lifeline to many individuals that would not seek mental health care otherwise. So it is really very impactful when you see that in the real world.
Won't it be nice when we don't have to have such defining conversations about mental health, when it's just part of your overall care?
Absolutely. It's interesting that you actually posed that. I was recently hosting a client panel at an event that we had down in Florida recently, and we talked about when will virtual be dropped from the term virtual care, and it just becomes about whole health care, right? And how we access convenient care, but two, it is complementary. When you're diagnosed with cancer, the stress and anxiety of the human condition will certainly be elevated, right? And I think naturally that should come with mental health care. So when we start to integrate mental health in all that we do across that human, the human care, we'll be better off as a society.
Absolutely. We're just this is what's so great about what I get to do and having it be this platform that is mental health laser focused. But we have a woman that is coming on to do a show for people that have terminal illnesses, and it's going to be about helping them with their mental health during that time, whatever time left they have because of their illness. And I know from speaking with her, because she's a psychologist, how important is that? There's no other show on the planet that's going to focus on that. And how many of those people, her listeners, are using virtual, telehealth services in order to get what they need? I mean, like 90%.
Right. Absolutely. It's honestly, it's more convenient, certainly, but it should be a part of your complete care plan, right? Especially, facing down a diagnosis like that.
Absolutely.
And as usual, creating awareness is an important piece of the work that not only we're doing, but that other companies and overall healthcare agencies should be doing as well, since in the US, over a third of employees are not aware of what sources of support are available to them in the workplace. So that continues to be an issue.
Yep, absolutely. Well, is there something that you could do to kind of explain how it works? General public call in, or an organization calling in to find, okay, how do we get started with this? Can you kind of give us a lay of the land there?
Sure. I had mentioned earlier, our mission is to transform the way people access care and experience quality healthcare around the world. And the services are available through global employers, health plan, global insurers, hospital and health systems. And through those channels, we reach members and resolve their healthcare needs across a full spectrum. And we look at, obviously, virtual care as the front door to the healthcare system. Mm-hmm. And that is inclusive of things like expert medical opinions, the session that you're going to run shortly on, significant diagnoses around cancers. Those are really difficult to navigate. And I think pairing those with a mental health service to help that patient navigate that time of need, I think, is critical. So all of our clients generally come through those venues, and then we reach the members that way. Our website obviously has the research that we were talking about today. People can reach it at teladochealth.com. All of that research is available. But also what we've done is we've packaged it such that it's a bit of a toolkit for employers that are interested in having these conversations. We can't all be like Lady Gaga and have the platform to talk about mental health and lead with such authenticity and transparency, but we can as organizations, and so for us, it's important to get the message out there, the research, obviously, but then beyond that, package it in a digestible format so that people can start to introduce those conversations into their own workplace, because that's how we're going to start to break these barriers down for people and give them the care that they need.
Fantastic. Well, thank you both, Dr. Gustavo Kinrys and Kelly Bliss. I love that last name, for coming on my show. And this is the first time I've had an organization really tell me, and tell the listeners exactly what telehealth is. So I appreciate that. I think you've just helped people understand it's not something to be afraid of, and it actually can make getting things like your mental health care a lot easier than it ever has been before. So I thank you both for that.
Well, we appreciate it. Thanks for having us on.
Thank you very much.
Absolutely. And listeners, thank you for tuning in to another episode of Mental Health News Radio.
Sometimes I'm passive aggressive, but never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps, or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you. After all, we promised we'd be cordial. Sometimes in you I can find it.
Good boy.